Hi, my name is Michael Dabrowski. I'm a licensed acupuncturist, and today I'd like to talk to you about how to teach self-care via telemedicine using the Simplified Emotional Freedom Technique, or EFT, for anxiety and depression during COVID-19. So I have a specialty in acupuncture mental health as well as pain management, and I've been in practice since 2014, currently working on my doctorate in advanced pain management at Bastyr University. So why COVID-19 mental health? Well, right now it's a major challenge for many of us, and many people are experiencing anxiety, depression, and helplessness. Stress is also well studied in terms of it reducing our immune response. And in the limitations of our online environment, it's important to teach patients self-empowerment techniques that they can use between sessions to find some relief from mental health challenges. During a recent survey in China that was done online, over 7,000 respondents with COVID-19 knowledge stated that they showed an increase in anxiety, depression, and sleep disorders, with the highest risk populations being young people, people spending too much time on epidemic news, as well as healthcare workers. Stress, when it's chronic and lasting longer than a few hours, can suppress and dysregulate our immune system. It can prevent our immune cells from maturing and from moving to the places in our body where they're needed. Chronic stress also induces low-grade chronic inflammation in our body and alters the balance of cytokines. As many of us have heard, cytokines are a major issue in COVID-19 infections, and the cytokine storm is an overreaction of our immune system, which has been linked to increased morbidity and mortality. People with pre-existing conditions have an elevated cytokine level already, and this includes conditions like diabetes, cardiovascular disease, autoimmune diseases, and leaky gut or intestinal permeability. Because stress also increases cytokines, all of this collectively can reduce the tipping point for the cytokine storm to occur. Therefore, it's important for us to lower our stress and to work on these medical conditions in order to ensure a good prognosis should we ever contract COVID-19. So why the emotional freedom technique? Well, it's based on traditional Chinese medical concepts as well as neuro-linguistic programming. It is very highly effective, and in all of the studies that have been done, and there's been a lot of them, in the meta-analyses of those studies, it shows that EFT is 98% effective for treating certain conditions, so much so that it's being adopted in some hospitals, and nurses are being taught how to use this for themselves, as well as how to teach patients how to use this. So it's very easy to teach, and it can be done anywhere, and it builds self-awareness and self-empowerment in our patients. So when we build self-awareness, we have a greater chance of knowing when we are having a stress response and how to work with that stress response early and often. In a meta-analysis of 14 studies, EFT has been known to increase, or rather decrease, anxiety scores, and when compared to cognitive behavioral therapy, it's been found to be just as effective as CBT, but because it can be self-administered, you don't need a practitioner in order to get the benefits. In a study of over 200 participants in a 4-day training workshop where they did comprehensive healthcare exams and blood work, post-workshop results showed a marked decrease in anxiety, depression, symptoms of post-traumatic stress disorder, a huge decrease in pain, as well as cravings. Additionally, there was an increase in happiness, as well as a significant increase in secretory IgA markers in the blood, which are known to inhibit microbial activity and neutralize toxins. Also, a pretty substantial decrease in cortisol levels and a decrease in resting heart rate and blood pressure. And these results tended to persist after the EFT training and in the follow-up that was done after. So how does EFT work? So it's made up of two components. One is the neuro-linguistic programming component. And this is where we're essentially bringing focused awareness and using language to identify what it is that we're feeling, whether it's an emotional issue or a physical issue. The language part is important because the more accurate we are in describing what we're feeling and what's going on, the bigger chance we have to actually accurately interrupt that trigger in the brain and to reduce the flood of neurochemicals that are causing the stress response. So EFT is focused awareness on the experience of emotional pain with the simultaneous stimulation of acupuncture points. And it's useful for many psychological as well as physical conditions and belief patterns that are causing us stress. So how does EFT actually work? So first, if we start at the bottom, you will bring to mind an emotion, a trigger, a scene, or a memory. The memory or trigger activates our amygdala and arouses the threat response. We then stimulate acupuncture points to deactivate this signal and reduce arousal while the trigger is mentally active. The hippocampus then records the trigger is safely being engaged without firing the stress response. The neural pathway that initiated the stress response is then permanently altered through this intervention. And the person can engage the trigger again without the stress response firing. And the no limbic arousal becomes the new normal way of relating to the stress response. So how does a session like this actually look like? So first we will identify the cognitive trigger and we will state a certain mantra, a certain saying that sets up our ability to work with the trigger using our mind and our feelings. And then while we're saying those words, we're performing an intervention using our fingers that activates certain acupuncture points and meridians that help discharge and depolarize the neurons that are firing. So we'll talk about how to join all these things together, but the physical part of this will look like this. We'll begin at the eyebrows with both hands and sweep to the back of the neck. As you bend your neck forward, there will be a bone that will protrude, that will be the highest bone. You will then tap on that bone several times, 3, 5, or 9 times. Then you will join your hands together like this, reach behind you and sweep down the center of your spine, activating the center of the spine and the points on either side of the spine. So this is what that looks like. Reach back, stroke down the spine all the way down to the sacrum as far as you can reach. So you will repeat this 9 times. You will be also saying a mantra during this time, which we'll talk about shortly. Once you're done this procedure 9 times, the second phase is to tap all of your fingers. Left hand first, right hand, left foot, right foot. You will use 2 fingertips or 3 to tap on both corners of each of the nail beds, and you will tap 3 to 5 times. You'll also be saying a mantra during this time. It'll be a shortened form of the mantra, okay? And then that's it. Okay, so that's 1 round. The sweep with a mantra 9 times. The fingertips with a mantra. You'll say the mantra 3 times. Here's what that looks like. So the mantra can look something like this. Even though I'm feeling anxious, my heart is racing, I'm overwhelmed, my life feels so difficult, I can't take a full breath, my children are stressing me out, I'm so angry about the news, the world is coming to an end, I'm so tired and exhausted, whatever feels right, whatever feels appropriate, right? So even though, let's just pick one of them, even though I'm feeling anxious and my heart is racing, I totally and completely accept myself and I love myself. So you'll use this statement 3 times as you're performing the sweep 9 times. Even though even though I'm feeling anxious, I totally and completely accept myself and love myself. Even though I'm feeling anxious and my heart is racing, I totally and completely accept myself and love myself. Even though I'm feeling anxious and my heart is racing, I totally and completely accept myself and love myself. I'm feeling anxious. My heart is racing. I'm feeling anxious. My heart is racing. Anxious. Heart is racing. Anxious. Heart is racing. Repeat on the toes. Once you're done with this, the session will come to an end, and you should allow yourself a minute to rest. You will feel very tired, fatigued, or confused after you've done this whole series. Confusion is actually pretty common, and as the thought you were having no longer triggers the response you were having before, so it's kind of confusing. Like, why am I still saying the things that were causing me a trigger, but I'm not feeling them anymore? That leaves some sense of confusion. That's normal. So allow yourself to sit in that. And then as you sit in that, you may find something else comes up. Either the confusion itself feels uncomfortable and you don't like it, or you will find another trigger. Maybe you will think that, oh, now I'm really experiencing grief over the death of a loved one. Or right now I'm really in pain. Okay, well then you work with that trigger. And so you'll say, even though I'm really sad and I'm feeling a lot of pain, my back really hurts, I'm getting headaches, and I'm scared, I totally and completely accept myself and love myself. I'm scared, I'm sad, I have pain, my back hurts. And you do the feet. And then you rest with that. And if there's any new waveforms or any new thought forms that comes up, you repeat that again until you get to a space of nothing, where you're not being triggered, you're not finding anything is stressing you out. And by this point, if you've done this 2 or 3 times, you'll feel very tired and you'll probably want to lay down. And that's a good time to no longer do any more of this. So allow yourself plenty of time to get rest and water. And if need be, you can repeat this a couple times a day or each day with whatever's coming up. So you don't have to work with the same thing. You're just working with whatever is coming up in the moment that is leaving you stressed and uncomfortable. Okay, so that gives you a brief crash course on how to use Emotional Freedom Technique, the simplified version. There are other versions. Those versions utilize tapping on specific acupuncture points, and they can be very helpful for all sorts of other conditions and working with things more specifically. So here's a few really great books that I'd recommend that you take a look at. The first one on top is actually a New York Times bestseller, and there's a few of them on the Emotional Freedom Technique. And the ones on the bottom are examples of working with EFT for pain relief specifically, or working for stress-free living. So very good reading. There's also lots of really great YouTube videos on examples of how to apply the Emotional Freedom Technique. And acupuncturists can really utilize this really well using acupuncture points. If you're interested in looking at the references I've used in this presentation or want more information, please feel free to send me an email or reach out to me by phone. Lastly, if you're a patient and are considering using the advice from this video, please remember that while EFT can be very helpful, It is not a substitute for working with a qualified healthcare provider. Please contact your healthcare provider and find out if EFT would be appropriate for your situation.